Memorial, women have birthed life, shaped character, and by extension, influenced the society. Moremi of Ife, Emotan of Benin, Queen Aminat of Zaria, all women of influence and power.
Whether it's before election, after election.
How ironical, women being so powerful, yet have few grounds in decision making.
I see you as a wife, and I see you as a wife to a man.
We are talking women in politics.
A woman will be bold enough to stand up and say, I want to become president of Nigeria.
Only on Core TV News.
Hello and welcome to Core Digest. I am Frank Omalape, and this is a special edition of the program. Of course, looking at the fact that yesterday we really talked about what concerned, what borders and humanity, the right of human and all of that. But today we're just taking it to the health sector. You remember just within the week earlier, the report, the federal government says that about 29 Nigerians stand at risk contracting, Lassa fever, and 26 states of them are really exposed to the disease. I beg your pardon for that. 29 million Nigerians. That's what the report says, and we begin to see a lot of reactions to that, fears and all of that, and how we're here today to educate you what really is Lassa fever. And joining us in the studio to really talk about this today is Dr. Olusegun Akinwotu. I beg your pardon, Akiwotu. He's the second vice chairman of NMA Lagos, Nigerian Medical Association. Thank you for joining us in the studio.
Thank you very much, Mr. Frank.
Yeah, let's look at the report. We might need to, come to the area where we'll track up the Minister of State for Health, Hassan Kalero, later on, just to hear what he has to say about that. But let's quickly get straight to the business of the day. A lot of people are really scared out there that it probably is deadlier than Ebola. What really is Lassa fever? And, how is it different from Ebola?
Lassa fever is an acute hemorrhagic viral disease. It's in the same class of illness like Ebola. Likewise, dengue fever. And we call the class hemorrhagic fevers. And the way it is, its means of transmission is from animals, for example, rodents. The same way we have Ebola coming from chimpanzees, monkeys, and bush rats.
Okay.
So we should, see that these are things that come almost from other animals to human beings.
Okay.
However, the Lassa fever, which we had last as an epidemic in Nigeria 2 years ago in 2012, has its various symptoms, also similar to that of Ebola.
Okay.
And even to some extent, because of the fever component, similar to malaria.
Okay.
So the same way we have symptoms of malaria, the general symptoms of fever, body pains, sore throat, headache.
Okay.
The same way it is in Ebola, the same way we have such symptoms in Lassa fever.
Okay.
So the doctor or the attending clinician requires a very high index of suspicion to be able to determine if this is Lassa, Ebola, or it is some other forms of fever illnesses like malaria. However, diagnostic process is done in the lab. There are processes in the lab, some laboratory techniques that determines what exactly the cause of the fever is. So that's how it is actually diagnosed. It's a laboratory-based diagnosis.
Okay. But you talk about symptoms. Let's look at these symptoms. You say they are similar.
Yes.
But they are not the same with
same.
Ebola. So let's look at the symptoms of Lassa fever.
Yes. Symptoms of Lassa fever. It starts, we have the general symptoms. Fever, myalgia, that's muscle aches, and bleeding from orifices, which could be forms of mucosal bleeding and sometimes conjunctivitis. Now, it now moves to the organ involvement. it can affect almost all the organs in the body. We start with the gastrointestinal organ, which is the GIT.
Okay, maybe you need to break it down a little bit because some people don't.
Gastrointestinal.
All right.
That's from mouth to the anus. The system that compasses that. We could have nausea. We could have vomiting. The vomiting is bloody. The diarrhea is also bloody. There could also be some form of abdominal pain.
Okay.
And constipation, depending on the presentation it wants to have. You understand? So these are things that may occur in the gastrointestinal system. Now, in terms of the cardiovascular, that's the heart and the other vessels.
Okay.
We could have hypertension, we could have hypotension, we could have what we call pericarditis. That's
which
some
means
inflammation in the heart that leads to liquids. We have fluid accumulation in the cavity of the heart. You understand? So those are things that could also occur, which leads also to tachycardia. The person begins to have the heart beating very fast.
Okay.
So those are the cardiovascular components. There could also be the neurological component. Neurologic, we could have some neuropathies, and likewise we have sensorineural deafness. Deafness may occur, meningitis could occur, and at the same time, this could eventually, lead to other things. And when this goes on, because of diarrhea, loss of fluid, vomiting, the person could go into peripheral shock.
Okay.
There's hypotension. The person goes into shock, and if not taken care of, the person eventually dies.
Okay.
So those are the
doctor, maybe we need to
cascade of symptoms.
Maybe you need to realize, I'm sure a lot of people want to, listen to you and learn, few things from what we're going to be discussing here today.
Yes.
Okay, we discuss about symptoms and all of that. Are these, transmittable, just like Ebola? A lot of people fear Ebola and all of that. Thank God we're able to contain the Ebola, and within the few weeks that, we had it in Nigeria here. But then, is this Lassa fever transmittable just like, Ebola, since the symptoms are similar?
The source of Lassa fever is ubiquitous.
Okay.
Everywhere.
Okay.
It's primarily from rodents. That's the rats, mouse that we have, the rats we have running around.
Okay.
So certain of them, a particular strain of the rats, which is commoner in West Africa. That's why it's endemic in West Africa. Lassa fever was actually first seen in 1969 in Lassa town in Borno State.
All right.
Yes. So it's seen in those rodents, the rats. And these rats infiltrate grains, rice, beans, just those grains. They excrete there. Okay. They pass urine and excreta. Okay. And this could be taken up. They get aerosolized. Dust raises them, you understand. Through certain processes, they become particles. So they can be inhaled. So through inhalational means, through respiratory means, we can get them in. And through contact with those meals, which actually the person could, have them, go through broken mucosa, broken skin. So it gets to human beings through those means. Okay. So it can come from the animal to human beings, and also from human to human.
So what are the measures that need to be taken? Because in the case of Ebola, one of the primary measure that was, recommended was the washing of hands and all of that. Yes. Does that also apply in the case of Lassa fever?
Yes, it applies in the case of Lassa fever. We first of all try to see how we can keep the entire environment clean and free from rodents. When we talk about these rodents, the rats, let's ward them off away from our homes. It is very vital. Then secondly, whenever anybody is suspected to have it, the person should be also isolated. And proper disposal of the person's excreta, that is urine and feces, so that people don't have contact with them. Because once any human contacts it, the person also can excrete it, and then if it's handled by other human beings, it gets transmitted through such means. So we should also maintain adequate personal hygiene, very vital. also proper hygiene, washing of hands, and disposal of likely contaminated materials properly would prevent further transmission from humans to humans.
Yeah, so you said if once we notice that person should be isolated,
yes.
And
And
probably
treated.
quarantined, just like
Yes, isolation, quarantine. Yes, that's the
okay.
approach.
So let's look at does it also apply in the same thing when we had someone has to be quarantined for 21 days to go through all of that? Just give us a bit of that.
That's the approach. They are quarantined and they are managed this in a special manner, such that the management involves use of certain drug. There's an antiviral drug that can be used for it. They call it ribavirin. Ribavirin is used in the case of Lassa fever. Once the person is identified early presentation will lead to adequate intervention and a better prognosis. That is, the person is likely to survive the illness once the person presents early. So the other management include rehydration. If the bleeding from the vomiting and the stool actually is extensive, you may need to transfuse the person. You understand?
Okay. Which means
following adequate protocols.
Okay.
And then the person gets lost nutrients through IV intravenous infusions and through other means. And any body aches are also co-managed, and the person is likely to have a better chance of survival.
Okay, Dr. Olusegun, you talk about using antivirus, which is a drug, which is called ribavirin. Is that exactly what we use? Because from the figure I have here, we have over 1,000 people who were, affected in 2012, and over 207 died from that. Was that what? Of course, out of 1,000. 207 we had were victims and they died. Was that what we use in containing this at this time, or do we have it in the country at the moment?
Ribavirin is available. It's not something that is difficult or very. It's just that for the people of probably low socioeconomic status, it may be a bit expensive, but I don't think it's way off out of reach of being purchased for use. It's not that expensive, and it's not out of reach.
So you say it's a bit expensive.
No, it's not. It's not expensive. No, I said it's expensive.
Okay. But let's look at it now. The impression about Lassa fever is that it is deadlier than Ebola. Do we have to? Maybe you have to clear that air. You see, how deadlier it is? How since it's similar, the symptoms we have in Lassa is similar with that of Ebola. How deadly it is, because even when the Minister of Health, State for Health was speaking, he also probably make mention of something like that. How deadly it is?
It actually depends on how you look at it. As I said, they are both hemorrhagic fevers of the same viral source.
Okay.
Right? And transmission is through practically almost the same means.
All right.
Animals to humans and to other animals. And once it gets to a human being, the dependent factor is how soon does this person present to the hospital. Okay. If the person gets an urgent treatment, urgent medical intervention, in both cases, they are more likely to survive. Okay. You understand? So those are factors that determine whether the survival rate will be high or not. That's what determines fatality. However, literature, based on studies, have said in terms of Ebola, Ebola is about 70 to 90%, while in terms of Lassa fever, 50 to 80%. It's almost, equal in almost in the same range.
Okay.
So there isn't much, but as I said, it's the kind of intervention available and how early the person presents that determines if the person will survive. Those are the factors that determine. In the face of everything being, available, that's standard temperature, pressure, standard environmental factors available. It depends on how early the person presents.
Okay. Let's look at, apart from the simple hand washing, which also apply in Lassa fever, are there also other measures we need to take immediately once we got to know that, okay, this person has contracted Lassa fever? What are the initial measures we need to take?
The person should be isolated.
Okay.
we should avoid contacts with bodily secretion, excreta from any form of excreta, sweat, semen, blood, urine, stool. We should avoid having contact with such. The person should be handled immediately by experts.
Okay.
And the experts should also be properly covered to be able to handle them. They know what to wear. They have their gadgets, the gloves, the goggles, and all other face masks and the rest, overall apparel, to be able to attend to the patients without being at risk of getting infected. So those are measures people are taking to their special intensive care centers, because sometimes if respiratory involvement takes place where they have difficulty, we may need to use assisted respiration for them, and we need to manage that appropriately. So other measures, as we said, is ensuring that whoever is suspected is taken away, and then we should ensure we have adequate environmental hygiene. Proper environmental hygiene and proper individual personal hygiene too should be maintained.
Okay, you talk about experts. Do we really have these experts? Because in the case of Ebola, though we were told that we were not really, as a country, we were not prepared for it. It just came and hit us like that. But the case of Lassa fever, the first time I think we'll have it, or that I heard about it, was in 2012, isn't it? Yes. Now, that means we already have experience about that, and we know, okay, this is how we can contain it. But really, are we still prepared for in case of any outbreak at the moment? Because you talk about experts. Do we really have experts?
We have experts. In this, we have experts on ground.
To take over.
Yes, we have experts. It's a multidisciplinary approach. You understand? Okay. And when we talk in terms of, we have the preventive health team on ground, who is also going to ensure that even while there seems to be an apparent epidemic, they are handling others, preventing others from getting infected. Then those who have already fallen ill, there are experts who know how to manage them. It's a holistic team. It includes the virologists, also the microbiologists, which biologists are also under microbiologists anyway. There are special microbiologists who are involved in the management. It also involves the pharmacy team, the nursing care, and then other physicians who manage comorbid illnesses. Because once you have multi-organ involvement, you have the respiratory physician, you have the cardiologist and the gastroenterologist. All hands have to be on deck to ensure the patient. And I'm sure all those who have managed such cases in the past, we have people who have been trained to do that. But whether it's Lassa fever or Ebola, I think we have enough hands on ground who are experts to know how to manage them.
Okay, the federal government said about 29 million Nigerians stand a risk at contracting this Lassa fever. After it happened the first time in 2012, I know that this announcement is coming out. What's this time? What is the implication of it for this country as in Nigeria, as it stands now? 29 million stand a risk of contracting, and the case we handled in 2012 was about 1,000, over 1,000.
1,944 cases, of which I think about 207 actually died.
Okay, but now 29 million Nigerians
at risk.
So
at risk. The thing is at risk. There are centers that are, we call them epicenters, states who have actually more potential of being one of the ones that will have the epidemic.
Okay.
Because of certain other things, maybe due to urban nature, and then probably due to other things like the preponderance of the rodents in those areas, you understand, and the past occurrence, that is those who have experienced, they've seen certain isolated cases in those states before, you understand. So if in based on statistics, that 29 million is an extrapolation.
Okay.
That if certain care is not taken, if we don't maintain proper hygiene, if we don't kill rats, if we don't do away with those rats that are likely to cause it, if we don't make sure that when this happens, we are on ground to be able to be alert, to ensure that we put all personal preventive measures in place to prevent transmission to other human beings. If all that is not done, 29 million in 26 states, are likely to be affected. So those are just statistical projections. It's not as if, whether we like it or not, 29 million would die of Lassa fever. It's just
Not even about dying now, contracting it now.
Yes, I was saying contracting.
Okay, assuming now we have there is an outbreak of this epidemic, can we handle it from our experience in 2012?
We should be able to.
So
we should be able to.
Okay, so what you're saying is that if it happens, we should be able to, contain it. But do we have what it takes really to handle in terms of equipment at this time in this country? Because a lot of people are still saying, Nigerians are saying, no, the healthcare sector is really not is really neglected. So what's your take on that?
Yeah. On the average, level, right? We have certain equipment in place.
Okay.
To the extent that if there's a presentation, it could manage immediate victims. That is those who have actually fallen ill and cater for them. If now we have numerous people, more people falling ill, having the same Lassa fever, it may exceed the capacity of what our healthcare can actually handle.
Okay.
If it's, there are ways. You go to a hospital, like for example, you go to a 10-bedded hospital, and then you are bringing 20 patients.
All right.
The number of people presenting have exceeded what we can handle, except that happens, which I don't think is likely to happen. Once a case is isolated, that's why that awareness went out on yesterday.
Okay.
That was the Lassa fever, more like awareness day. You understand? So the enlightenment now has gone out that this is a grave danger if we don't handle it properly. So we are now telling you these are the possible sources of contracting it, and these are the identified symptoms that are associated with it. Once you know somebody has it, report on time. Now, if we report as soon as one case is identified and is isolated, it's not likely to affect many others. It will be handled from that level. And possible means of transmission, either rodent-human or human-human, will be curtailed because experts will swing into action. So it won't get to an extent where it will overwhelm our medical facility that we cannot handle it. You understand what I'm saying? Yes, our healthcare system is evolving. We could get a lot far better than where we are now. But then, making do with what we have, we should still be able to contain whatever outbreak that may want to emanate from Lassa fever.
Okay. Oh, just before we go on break, Dr. Olusegun, where are we now? You are the second vice chairman of the Nigerian Medical Association, Lagos chapter. Where are we now in terms of healthcare sector giving priority to health in Nigeria as it is? And Nigerians sometimes we just take things for granted, and maybe sometimes we attach it, we blame poverty, and sometimes we blame, the government is not doing enough, really. But where are we right now when it comes to healthcare sector in Nigeria?
Thank you very much for that. There are certain indices that are used to assess the state of the healthcare system, like maternal mortality and child mortality rates. All this over the few years are dropped. But then we could still make it better. There are other things we also check. In terms of healthcare professional to patient ratio, how well are we faring? In terms of availability of certain facilities to manage certain particular health conditions, how well are we doing on that? In terms of training and retraining of health physicians and healthcare providers at all levels, from nurses to pharmacists to the laboratory staff. Okay. How well are we training people to be able to be knowledgeable enough to manage contemporary medical issues? Those are aspects we need to look at. We need to improve all that. In terms of government policy, a lot still needs to be done. Like the National Health Bill is yet to be passed. If we pass the National Health Bill, it will include universal health coverage to the tune of about 100% for all Nigerians.
Okay.
You understand? And then when we have good access, adequate access to well carried out health care delivery services,
Okay.
you know, that will be good for every level of Nigerians, not just those who have the financial powers to go and treat themselves at the best hospitals in Nigeria or abroad. So if we don't really put a policy in place that favors the ordinary Nigerian, which give them easy access to affordable and adequate healthcare, I don't think we have been able to achieve the best we can for our citizens. The country can afford it. Our country can afford it. What some government officials spend on going for checkup outside the country, if you add it all together and reinvest it in the Nigerian health sector, it will go a long way to improve our health sector, rather than taking our money to other countries outside to improve their own health sector by paying to them.
Okay. All right, Doctor, we will have to go on break now. When we come back, we'll really need to take a look at some of these things. You talk about training of health workers, personnel, and all of that, and government policy, and of course the national health bill, which you talk about. I think we need to
improving the health facilities.
I think we need to take a look at all of these in relation to, you know, handling epidemics such as Lassa fever and Ebola, or any other one that may come. Let's quickly go on break now. When we come back, the lines will be open. You can call in and make your contributions or ask questions. Dr. Olusegun Akiwotu is still in the house. He is the second vice chairman of NMA Lagos chapter. We'll be back after this time out.
The deadly Ebola virus is again spreading in West Africa. The virus has fatality rates of up to 90%, meaning many who contract the disease die. As subcontinent have witnessed over 900 deaths, please help prevent the spread of Ebola by observing the following precautions. This is a social responsibility awareness campaign of Core TV News.
Glad to have you back now. We're still discussing Lassa fever. Is it deadlier than, how deadly it is? Is it deadlier than Ebola virus? A lot of people are beginning to, you know, raise concern how Lassa fever is deadlier or whether it's not deadlier. Dr. Olusegun Akiwotu, the second vice chairman, National Medical Association, Lagos chapter, is still here in the house. And of course, he's been talking about, and he says exactly, you know, it's not deadlier, but they have similar symptoms. Lassa fever has similar symptoms with Ebola, and that has been his answer. So you don't need to, you know, be afraid. That's his word. Well, Dr. Olusegun, let's quickly go straight to now. According to the Minister of State for Health, Hassan Kaliro, it says over 1,944 cases of Lassa fever in 2012, about 207 died. Now, we'll come back to this health bill and national issues and all the policies and all of that. But according to him, he says most of the victims really were health workers who were not protected, were not adequately protected. Could that be because they were not properly trained to handle it, or there were not enough equipment at that point in time where they were attending to these special cases of Lassa fever? Well, what can we say? What have we learned from that outbreak in the past of epidemics that we had in this country?
Now, in terms of the number of people who contracted and died at that time, most of them, as you said, were healthcare providers.
Okay.
Now, if there wasn't adequate awareness, public awareness, that this infection is actually in town, that is, the country has actually seen a patient who has a WHO reportable illness.
Okay.
These are illnesses, once you isolate a case and it's confirmed, you must report it to Center for Disease Control.
Okay.
It's an international a disease that actually has international importance, so we don't want to play about it. Probably at that time, the awareness, it wasn't as much as the way we have actually projected Ebola now. So if there wasn't an index of suspicion by the healthcare provider, they may not have known they were dealing with Ebola, Lassa.
Okay.
So adequate prevention by themselves, they probably treat like normal malaria. And by the time you do that, you're trying to think, oh, this is malaria. We have some malaria symptoms that would lead to some degree of severe malaria. Severe malaria sometimes could cause bloodies to vomiting with stool, with blood and all that. So if the person likened it to just ordinary severe malaria, he probably may not have protected himself the way he ought to have.
Okay.
That's one. Two, proper training of the same healthcare providers in the face of managing Lassa fever. That is also required. You understand it? And then were these patients quarantined so that those who are having access to manage them actually need to be well protected with personal protective equipment before they have access to those people? So were those in place? Were those measures in place? Then they do have adequate knowledge of how these patients are managed. So these are factors, and then means of transmission. Were those things actually in the fore at the time that epidemic happened then?
Okay.
And then, like you said, the facilities for management. I think we have a center in Edo State. There's a center, Edo, Delta Axis.
For Lassa fever?
For Lassa, yes. You have Lassa management centers. I think we have a few of them in the country. You understand? So, do we have more now? Is what we should be talking about. We need to provide the nation with more facilities by providing centers that are equipped with both knowledge, human resources, and facilities to manage these outbreaks.
Okay. Now, let's quickly go and take a look at this report. When we come back, we'll discuss more. Dr. Olusegun Akimoto is still in the house. Let's take a look at this report about Lassa fever.
Majority of us here were not even born at that time. So that means this disease is as old as anybody can get. The viral agent continues to pose an increasing public health threat to the population, especially with the rapid expansion of its frontiers. Initially, only very few states in Nigeria are endemic to this disease. But now, looping some of 26 states, including the FCT, we shall note that Lassa fever is both of regional and of international importance. Over the years, outbreaks of Lassa fever of varying magnitude and severity have occurred in Nigeria, Guinea, Liberia, Sierra Leone. During these outbreaks, the case fatality can be as high as 50 to 80%. This is telling you that it's as deadly as Ebola. Each year, we are confronted with outbreak of Lassa fever in several parts of the country with increasing magnitude and intensity. In 2012, the outbreak occurred in 26 states of the Federation, with a total case of 1,944 cases with 207 deaths, including death of doctors and nurses. That still will tell you how dangerous it is, the health worker. This is the hemorrhagic fever that are most deadly to our dear doctors, nurses, and other health workers.
At the beginning, Lassa fever, also had international attention, just like Ebola is having now. But within a short period of time, a drug was identified that can be used to treat cases of Lassa, and case fatality rate or mortality rate was reduced. So people became less frightened by the disease. But as it were, Ebola, so far no drug, no vaccine. And this is why, it's creating the scare.
There you have it now. The minister did say it's as deadly as Ebola. That's the word of minister here. But let's quickly take a look at these. What you're talking about, protective measures for health workers. And of course, the issue that we should also be looking at, is there a partnership between the health workers and, of course, the government providing facilities that the health workers should be, are using to, as a preventive measure against these. What can you say about that?
Yes, whenever we have such an outbreak of such an international import, various bodies come together. The federal government, NGOs, and all other stakeholders in the health sector. So there is adequate collaboration in order to be able to achieve the same goal of stemming, controlling, and managing those who have already been infected to the best, such that they can come out alive following being infected of the disease. So that collaboration always occurs. There are several meetings that are held. Various stakeholders bring various ideas to the table, and valuable ideas are adopted and synergized, so that both all can actually have the best done for preventing further spread and managing those who are already infected in such a way that they cannot affect other people.
Okay, it's this you talk about this national health bill. Is it all encompassing that will also have to take care of some emergency like Lassa fever and Ebola or epidemics across, or is something across board that even the common man on the road will benefit from it? Yes,
the national health bill is all encompassing. It actually involves provision of adequate health care with within the resources of a nation. All right. For as many people as require such treatments at an affordable and easy accessibility, and at the same time, it's going to give us optimum healthcare, that is world accepted standards of healthcare. So, and it involves having people, all right, placed on more like a health insurance. Okay. That's whenever there's an illness, there's access to healthcare without actually needing to pay much from their pockets.
Okay, let's also talk about the policies. We talk about government policies. What policy are you talking about? Is it about policy that has to do with proper health care to ensure that, okay, it's affordable? Okay, what exactly are you talking about when it comes to government policy?
When we have the National Health Bill passed, it will improve services provided by the healthcare sector.
All right.
It will be able to, okay, you have enough health specialists employed to provide specialist care. you have enough specialist centers provided and also well equipped, and people are employed to work in those places. You understand? The law, once the law says it, it must be done. You understand? And then it also says that there should be universal coverage for all Nigerians in terms of, you know, access to adequate, affordable healthcare. You understand that? So all this will be to the gains of the common man.
Okay, let's also look at the numbers of health workers that we have at the moment in the country. You know, of course, during when the government suspended the resident doctor at that time, we heard there were over 16,000 and all of that. Do you have an idea how much of numbers of health workers we have at the moment? Because sometimes it seems that we lack enough health workers to attend to issues such as epidemics such as Ebola and Lassa fever as is.
Yes.
Do we really have enough health workers?
We don't have enough. We're a far cry from recommended WHO standards. For example, it recommends a doctor to 600 patients. But what we have obtainable right now is about a patient to 3,000, a doctor to 3,500 patients, which is not acceptable. One, that will cause a lot of problems. Patients will need to stay longer. The doctor gets exhausted faster. And by the time he has seen more patients than expected, there is fatigue, and he may not be able to be mentally capable of providing what service is supposed to at that time. Imagine if there were enough doctors and probably the person is on call. There are, for example, 5 specialists who can do cesarean section on a night compared to what we have now, like 1 person or 2 maximum. And there are 5 to 8 women requiring cesarean section all night.
Okay.
You understand? If we had more doctors who are in the employment of giving those services and they can actually carry out that specialist service, more on call would mean that maybe the maximum one will do is 2 cesarean sections, which if you want could take you, some time depending on the complications that may be inherent in that process. You understand what I've said? Now, subsequently, you realize that it will be peaceful and in the interest of the doctor and the patient, so that when you've done few surgeries, that is just 2 for that night, you can retire while the next specialist comes to do his own. But a situation whereby you have 1 or 2 to handle about 8 cases, which means each of them will do a minimum of 4. One, in some institutions, they do not have more than 2 theaters at the labor ward.
All right.
And then if they are already having 2, and then another emergency comes, the tendency that that person may survive it is low. Because one, the 2 experts on duty to carry out that surgery are already in the theater. And then one, no more facility, no more human resource person to carry out the service.
So what you're saying
is,
yeah, as a country, we are at risk at running out of experts or specialists in the nearest future.
Yes, we are, because most of the time, we've at least over the years registered a number of doctors, and I can categorically tell you about more than 25% of doctors who have registered with the Medical Council have found their way out of this country. More than 30%. They've gone to places like Trinidad and Tobago, Barbados, South Africa, United States, UK. They all, because they believe there is the environment there is better for practicing the profession, and probably due to remuneration. But they always have what they require to work. They are required to work with. Here, sometimes you are taught with few specialist equipment, and even those equipments are even used by only the topmost of the consultants, because that is where few of them available, and then you can't easily have access to train with them and work with them. But if all this can be provided, there is more funding of the health sector. That's what we are saying indirectly. If all this required for us to work with are provided, certainly our healthcare will be better.
Who should be who should be responsible in providing all of these? Is it the government or the private sector, or probably the body the union body of the doctors itself. So maybe we should need to, probably we need to talk more about this. Maybe somebody is listening, and then we know that, okay, we are running short of experts in this area. So, and then somebody needs to begin to do something about this.
Well, you see, the way our country is, the government is in charge of most of the things.
Okay.
In terms of schools, government has majority. I'm talking kind of medical schools now. That's to train healthcare workers. In terms of even the institutions, the hospitals themselves delivering these services, government runs the biggest, because right now they have the biggest share of funds to invest in healthcare delivery. And our law also empowers government to do more in these areas to the benefit of the citizenry. That's the kind of system we have. Yes, some private individuals can also have centers where some of the services are provided, but how financially capable are they to build a state-of-the-art center that is affordable to citizens? That's the question. When you hear of the big hospitals in town, how many people can easily walk in there and get treated? So where a nation is well endowed like Nigeria, and our law, if we pass these laws properly and implement them adequately as they are supposed to, you will find out that if the amount as stipulated of your budget that is supposed to be allocated to health sector, if that amount is allocated to the health sector will be a lot more vibrant than it is right now, and we'll have reduction in overseas treatment, which is always advocated by our politicians.
So the work of the responsibility in providing all of these facilities lies on the government. Okay, let's look at this, Dr. Olusegun. You talk about, you know, Nigeria standing at risk of running out of experts. What is the process of getting more experts or engaging more experts? Is it from university level, or from the medical, or probably we have some general hospitals across the country, like LASSA is there and all of that. Is it the process? Is that the process? What is the process in ensuring that, okay, we have more health workers, not just mere health workers now, but experts in the system?
You see, it is important that our government, both at state and federal level, begin to see that the health sector requires more human resources, more to be trained. You see, many doctors graduate from the university. Undergraduate training makes you a general doctor. You become a general practitioner.
All right.
That is, you have a knowledge as a doctor. That's the basic. But the world now, like in other disciplines, everyone is getting specialized. And so when you're getting specialized, it makes your services more concise, precise, and accurate. So that also applies to the health sector. Now, even to get a placement for residency training is a problem. You apply to LUT, you see about 1,500 or 2,500 doctors coming to apply for residency training, for example, in LUT. And LUT will tell you at the end of the day they can't take more than 200 per year, or maybe 150 per year. Even placement for you to come and do your housemanship, which is the year where you have your first physical contact, the housemanship, that's the house job, is also difficult. You begin to go from one state to the other to be able to get somebody to take, okay. It even turns to, you need a letter from a commissioner, you need a letter from a minister for you to get taken. So we wish to let the government know that all these facilities should be, we should expand facilities and increase intake of doctors who have graduated from schools, so that we can have more people who have graduated as doctors, one, do their house job, and also be able to go further to do specialist training.
Okay.
As a matter of fact, Lagos State, as of 2 years ago, stopped the employment and then admission of doctors for training in LASSA. And right now, in the last 2 years, that has decimated the number of specialists who are in training in that institution.
Okay.
What is the implication of this? Over the next few years, you have reduced number of specialists who are produced to work in Lagos to be able to provide specialist service. And the federal government too, somehow, indirectly, seem to be towing this line because they are not increasing the opportunities available for trained doctors to get further postgraduate training in the tertiary institutions. So we could use this means to also appeal to the government to do a lot more in this area.
Okay,
so
what role is the enemy playing in pushing this information forward? Just like what you're saying now, have you taken any step as, okay, we're running at risk, this is what we've noticed, and all of that, and we need to start doing something about this? Because in a case where you have epidemics such as LASSA, we talked about Ebola the other day, and of course we're talking about LASSA now. Who knows, we might talk about another, and then the country, you know, standing at the risk of running out of air-sparks in some specialized area. So what is the role that enemy is playing in letting the appropriate authorities to know that this is what is needed at this time?
For example, we've had various press conferences during which we've actually mentioned, you know, and then also tried to appeal to those who are in various authorities to ensure that they don't stall this training. And then we've also highlighted, we even did more of that at the time the resident training was suspended. We did more of that because we had to emphasize the importance of these doctors to the health sector. And before that happened, because this Lagos State issue had been lingering, it had happened in 2012 until they've not employed new doctors, we went to the Commissioner for Health, who is the top echelon in their ministry. We informed him that we are aware they've not been taking new doctors and that the ones there are currently overworked. And at the same time, if care is not taken, they will stop, you know, having specialists, doctors produced in that center. They said they were looking into it. They've constituted a committee to try and see how they can revamp it. But till today, nothing has happened. And whether we like it or not, this is going to tell on the state, and it will tell on the nation as a whole. Because we have people who come from other states to Lagos State to LASSA for treatment. Because Lagos has the highest number of doctors in Nigeria. And now, if we are trying to decimate the number of specialist professionals we have through various government policies that we don't think is in the interest of the people, then the people will stand to lose. This, sorry to say, the politicians themselves, any little headache, you know where they go to. But LASSA is easily accessible to every Nigerian. Those who come to some private hospitals and they can't manage them, they refer to LASSA or LUT. And if the LASSA and LUT is not now producing, they no longer produce in adequate numbers required specialists, then it's going to portend a grave danger in the health sector for the nation.
So if I understood you very well, so the government should be, you know, involved in ensuring that, okay, a number of professionals that are produced should increase from this point that we are.
Exactly.
And then there should probably, you also talk about centers also should be, because we only have one center and that center cannot take more than 150 in a year. Is that what you're saying? And then the government also should be involved in probably providing centers where these people can be trained.
Yes.
Okay, as we bring this show to a close, Dr. Olusegun, let's look at because it's about Lassa fever and epidemic containing it. Now, let's look at what role should an individual play in the face of epidemic like Lassa fever. A lot of us were ignorant, you know, when it happened, and then before you know, from one person to the other, and then it's being transmitted, and then there's we now begin to see a chain reactions all over. Over 1,000 people were affected in 2012 about Lassa fever now. So what role should an individual play, or should we play as an individual to ensure, in the face of an epidemic like this, to ensure we stop an outbreak or spreading of the outbreak?
We would love individuals first to try to enlighten themselves, both locally, that is other states. If you're going to travel to a state, for example, when the Ebola matter came, it was in Lagos. People who were from other states were even avoiding coming to Lagos State. I'm sure you remember.
Exactly.
When they now said it was in Port Harcourt, Port Harcourt again, no, there's a conference there, we cancel it for now. You know, those kind of things. So we should enlighten ourselves, follow the news, go to, you know, read about health news and know where some certain diseases are endemic, and you avoid or prevent yourself from going there or passing through those countries. Now, the individuals should also be able to understand certain of the symptoms. They are there. We have various means. We have pamphlets. We have newspapers carrying symptoms of some of these illnesses. Whenever anybody around you has a history and begin to history of going to areas, maybe coming from Liberia, for example, recently, and eventually develop some of these symptoms, they should isolate the person immediately and call required authorities for proper evacuation of that person and treatment. And they shouldn't be heroes. Now, if somebody now had died of similar history and they are suspecting that it may be in any way, they shouldn't be heroic in the normal handling of dead body. They should inform experts to their special ways of which such people are actually buried. They should still inform, even if they were not able to inform the person before the person passed on, so that they will have minimal contact with the fluids. Because even when the person has died, the body secretions, the body also can still transmit, you know, the virus to those who come in contact with them. And then we clamor for adequate, proper, optimal environmental hygiene. We clamor for personal hygiene. And then, as much as possible, if you can, you know, reduce contacts with people that makes you come in contact with their fluids. You understand? Maybe carrying people in buses which are congested. You understand? Those are things that, you know, wash your clothes regularly, wash your hands promptly, and between one activity and the other, ensure, you know, you do sanitization of your hands, sanitize your environment also. Then, in terms of individuals also in the health sector, they are the ones who are more prone. They should ensure they have a means of screening people who are coming into their centers. And once there is, most of both conditions, whether LASSA or Ebola, fever is a major symptom in both of them. Once there is a high-grade fever that makes you suspect, try and see how you can isolate. Then whoever is coming to have contact with such people should be well protected.
All right.
They need to protect themselves so that they can carry out further investigation, take blood sample, send to the lab, meet, the person is febrile, you want to give antipyretics to bring out the temperature, you want to give antibiotics to do other things. The person should be well protected, adequately protected with personal protective equipment so that they don't contract it from that person and take to their houses because they are going to go back home. And that's why you see that a doctor is infected, or they say the wife too also got infected. So doctors or other health workers, either a nurse or whoever is a laboratory technician who is coming to, you know, take blood sample or come in contact with any of these patients should ensure that they are adequately protected.
Well, on this note, we have to say thank you very much, Dr. Olusegun, for coming on the show.
Thank you very much, sir.
And I hope you come again.
Thank you very much.
Well, that's what you can take today on the program called Digest. It's been very interesting here, and I'm sure you've been well educated about Lassa fever, how to ensure prevention, and also you need to maintain a very clean environment to avoid the spread or even contracting Lassa fever. Thank you very much for staying tuned and being there all along from the beginning of the program till now. I am Frank Omalape, wishing you a very happy weekend. Up next is News on the Air.
The deadly Ebola virus is again spreading in West Africa. The virus has fatality rates of up to 90%, meaning many who contract the disease die. A subcontinent have witnessed over 900 deaths. Please help prevent the spread of Ebola by observing the following precautions. This is a social responsibility awareness campaign of Core TV News.